Most patients think improving a smile automatically means veneers. Cosmetic dentist Dr. Pamela Vranis weighs in on smile enhancement options from simple whitening all the way to full veneers. Stay with us until the end when she reveals one of cosmetic dentistry's best kept secrets for enhancing a smile. It's something most patients barely know exists. We're really excited to have you weigh in on different smile enhancement options. So let's start out with your thoughts on just teeth whitening.
Teeth whitening is truly one of the first questions I get asked. It's hot, it's a trendy topic, and there's also an array of methods used out there to whiten teeth. You can start with anything as simple as just whitening toothpaste, which is very conservative. You're probably going to get the least bright result, but it's a great place to start. Most whitening toothpaste you can use every day. And then we move on to the whitening strips, which of course you can get over the counter whitening strips, or you can get prescribed from your dentist whitening strips. And those tend to be about double the concentration of over the counter whitening strips. So those are great, but their way of use is exactly the same as over the counter. Another option is a syringe that you can make whitening trays custom to you through your dentist. And you then buy also the whitening syringe, the gel that you fill your whitening tray with and just wear it as if you're kind of wearing a night guard or a retainer. And you've got the gel in that tray and of course up against your teeth. The final and biggest bang for your buck is the in office. The final and biggest bang for your buck whitening technique is in the office. So you go to your dentist, and you pretty much sit there for about an hour and a half, and you get the most potent whitening gel placed on your teeth by your dentist or the assistants. And that usually tends to be the highest concentration of whitening. So you'll get the best effect. That's great for before a wedding, before an event, where you really want that white smile and the biggest effect.
Are there risks with over whitening your teeth?
The biggest risk is just getting sensitivity. That's the biggest risk. Whitening is a soft acid. So while it's great to get out the stain from wine or teas or blueberries and smoothies, it is a soft acid, so it will dehydrate your teeth and leave you with some sensitivity. Granted, that sensitivity is temporary. So it's not going to last forever, but it takes maybe a couple days. But it's really the only side effect of whitening.
Okay. I've done lots of teeth whitening over the years and have had sensitivity, but it
It's
does.
common. It's common.
Okay, great. On the theme of smile enhancement options, a little different than teeth whitening, are most patients think improving a smile automatically means veneers. Cosmetic dentist Dr. Pamela Vranis weighs in on smile enhancement options from simple whitening all the way to full veneers. Stay with us until the end when she reveals one of cosmetic dentistry's best kept secrets for enhancing a smile. It's something most patients barely know exist. On the theme of smile enhancement options, a little different than teeth whitening, are aligners.
Aligners are also very trendy, and they're getting to be more popular with adults. Usually we find orthodontia to be a childhood, a teenage thing. And now more and more adults are straightening their teeth, maybe even doing a round two treatment where they had braces and Invisalign or traditional braces in their teenage years. But then things shifted. Maybe they weren't wearing their retainers, and they kind of want to go back and do aligners. There are many types of aligners out there. Invisalign being the most reputable and most commonly used jargon. out there. So that's become very trendy. And also, since they are clear, they are easy to wear in adult life while taking meetings, being a parent, being on Zoom calls, and not feel like eh, it's the only thing that someone can look at, like traditional braces.
Yes, I've had braces twice and done aligners twice. And with the aligners, we got to a point where we just couldn't, you couldn't move the tooth really. So, are there limitations like that? Keep
There
on.
are limitations with any option. Some movements are just easier physically, mechanically with braces. And then other movements are easier with aligner trays. And some options move teeth faster, others slower. Aligners tend to move teeth slower. So things can be a lot more predictable rather than with braces, it's tightening a wire and it just has less predictability. But maybe the movements, you can do more movements, maybe with traditional liners or just different kinds of movements. So yeah, all methods, braces, lingual braces, which are braces on the inside of your teeth, and aligners. They're all different methods, but and they're all tailored towards specific needs, lifestyle, movements, anatomy. There's a lot of factors that play into treatment with orthodontia.
Have you ever seen someone where kind of have like a black triangle in between their teeth? How do you address that? Stay with us until the end when Dr. Vranis reveals one of cosmetic dentistry's best kept secrets for enhancing a smile. Well, oh my goodness. I know we just scratched the surface today on different techniques for enhancing a smile, and you've taken us through a lot. And thank you so much for sharing this best kept secret. These composite veneers chairside is just an amazing, approach that I wasn't completely aware of. And I'm glad I am, because now I'm going to go to my dentist and walk in and say, Dr. Vranis gave me some information.
Absolutely. My pleasure.
Yes, thank you so much, Dr. Vranis. You are a gift to the beauty seat community. Thank you for your time.
Thank you.